Welcome to this edition of NextWay's Leadership Forum, where we shine a spotlight on innovation and entrepreneurialism. Healthcare and technology, these and the convergence therein are the biggest topics that we will be dealing with in the years to come, especially given the passage of the President's Healthcare Reform Act and its implementation requirements to do just that. So I am very pleased to talk to somebody here who is leading the way on that convergence of technology and healthcare reform, and also a lot more that he's working on. We're joined by now the Director of Oncology for Beaumont Hospitals, Dr. Adil Akhtar, joins us today. And first of all, Doctor, I'm so happy you were able to join us today here.
Thank you, Nancy.
Thank you. Good.
Glad to be here.
Good. Well, we're glad to have you because this is one of the topics that everyone has talked about for so long, that we need to move into the 21st century, or maybe the 20th century as it goes, relates to medicine and technology. And you are, given your research, a star researcher at Johns Hopkins University, now Director of Oncology at Beaumont Hospital. There's nothing more important than dealing with that technology, especially when you're dealing with something as serious as cancer. So is that the reason, first of all, that you personally have decided to innovate in the technology realm?
Yeah, Nancy, if you look at healthcare has always been at the forefront of technology, although it's against the common belief because most of the people still think that doctors are years behind the time of technology. But if you look at major innovation in technology, it has come from healthcare in the field of biotechnology, in the field of imaging, diagnosis. Where we lag behind,
because I watch House, so yeah.
So you can.
That part's good. So you were saying there's one area that hasn't caught up.
Right. So where we lag is the physicians and physicians' offices and physician to physician and physician to nurse communication. That's where none of the innovation has happened. If you look at the normal ways of communications right now, we are still using the old, outdated method of paging someone and then, I have to call them back. So that's where I started thinking about how can we improve the communication, because in healthcare and more specifically in cancer care, communication is everything, because there are now so many teams of physicians, nurses, pharmacists involved that if we don't communicate, we can't really take care of the patients.
Before we get to your solution, I read that somewhere that fully 50% of medical errors are due to communication problems among all these various people that you're talking about. That is astounding to me.
It is, and I can give you just real life examples. If in the middle of the night a nurse calls me, I call that nurse back, and if I order, say, an antibiotic which is called cefepime, that nurse can perceive it as something else, or ceftazidime, and when I go the next morning, I see that mistake. I really don't have any way of tracking it back because it was 1:1 communication and it was just through the phone. So there's no recording of that. So these mistakes are being made every day. Millions of dollars have been lost every day just because we can't really communicate effectively between the healthcare providers.
So what makes you different, and why you're on the Leadership Forum, Doctor, is your philosophy is in regards to where a lot of technology is moving, and that is decentralized mobile communications. Instead of big servers, even if you do go electronic, that you have a philosophy that I understand is called Muse. I'd like you to explain what Muse is and the whole concept of trying to decentralize that technology to meet the needs that you've outlined.
Yeah, it's actually called Muse from mobile news. what this technology is, that right now, if you look at the movement in the social media is really about centralizing everything. So if you are on Facebook or if you are on Twitter, everyone is feeding into a centralized server, and from there anyone can share that. My feeling is that in the due course of time, and that time is coming really rapidly, where all these centralized servers will be decentralized, so that if someone tries to shut, say, Facebook down, right now these are all centralized. You shut one central server down, the entire site goes away. In a decentralized mechanism, you can't really shut the entire site down, because there are hundreds and thousands of these servers spread all across the globe.
So we're seeing that in reality in the situation in the Middle East, where centralized control has caused the lack of communications widespread.
Absolutely. And in our technology, if you have a laptop and if you have our toolkit, you can be in a village in Egypt or in Pakistan, and you can create your own network of friends or reporters if you are trying to gather news from a site. So if Musi was in Egypt, there would be maybe hundreds and thousands of these servers or laptop converted into servers across Egypt, into which the actual people who are there on the ground protesting can feed their videos, photographs, and news.
You have a company that you're actually trying to focus these efforts on called HOSCOM, which is Hospital Communications, short for that. How specifically are you using decentralized communications to address the problems you talked about within these interdisciplinary teams that work in oncology?
So let me just give you a quick example. Suppose I see a patient with lung cancer. So that patient will see not only myself, I'm a medical oncologist. That patient will be seen by a radiation oncologist, will be seen by a surgeon, may be seen by clinical trial nurses to discuss clinical trials, social workers, psychologists, psychiatrists. So you can see that very quickly the team of the caregivers and care providers will increase in number. So right now, if I see a patient and there are 10 different clinical providers involved with his or her care, I have to actually pick up the phone, page every single person, then wait for their call back to communicate with them. Mm-hmm. What we are doing, we are using text-based technology, so cell phone-based technology, to communicate with the entire team at the same time. By doing that, we eliminate this frustrating experience of paging one person at a time, waiting for their phone call, then picking up the phone, talking to them.
How do you even know, doctor, who exists on that team? Because those decisions are often independent of you. You're not referring them to all those psychiatrists, all those other people. So how is it that you even know exactly who you need to be in contact with?
We don't. And that's where, our technology comes in very handy, because in our technology, the patient is the center of the communication. So anytime if a clinical provider is associated with the care, that provider will appear with that patient automatically. So if suppose a patient, Mr. John Doe, is a group, any physician who is in contact with that patient will be a part of that group. So when I text my clinical evaluation, it will go to all the participants of that group.
There are multiple benefits that...
And not only that, Nancy, sometimes, I have run a test. The patient will go to another physician. They don't know what kind of tests had been ordered or done. They will maybe order the same test. So then there may be duplication of testing that increases the cost of care.
Which now, with the healthcare reform issues, Doctor, as I understand it, the model is changing where it's patient-centered care, and there is a fixed sum of money attached to that patient. So there is a new incentive for the hospital and for all the other clinical providers down on through for physical rehab into nursing homes even to be communicating to avoid that, because they're penalized by those mistakes. And if someone's coming back to the hospital, it doesn't help them. So it's ever so important that people have this information in real time.
And also remember, the system had been broken throughout. So it had to be that the patient is in the center of all this care, because it's not about me or another physician, it's about the patient. So I actually agree with the healthcare reform in which the patient is the center of care, and that's why I think our technology is timely, because in our technology, patient is at the center of all this communication.
Right. What are your next steps in implementation?
Well, we are getting ready actually this week to start a pilot project with a group of physicians at Troy Beaumont Hospital. And by the way, I'm the oncology director at Troy Beaumont.
Oh, Troy, okay.
So once that pilot is done, that will prove the model. We have already talked to the highest levels at Beaumont Corporation that once this pilot is successful, they will roll it out in a stepwise manner to the broader audience in the Beaumont Corporation. And then hopefully from there, we'll go outside of Beaumont.
Right. Well, if I'm a patient at Troy Beaumont, I want to be part of that, because I want to know that all my clinical care they're all my friends on Facebook. I want all of them talking and knowing what everyone's doing. I want them tweeting and constantly conversing to provide my care. I think it couldn't be more timely. It's why you are on the edge of innovation and focusing on it. Any last thoughts?
Yeah, let me just add one more thing. You say, Facebook and Twitter. Remember, these sites are not secure.
Yeah,
right?
That's true.
So, and I can tell you that right now, the physicians are communicating or starting to communicate by texting, and they text private information. But right now, texting is not secure, and it's not, what we call compliant with
HIPAA, right?
HIPAA,
Yeah.
or the government privacy rules. Beauty of our technology is that it's HIPAA compliant and it is secure.
Because it's encrypted?
Because it's encrypted.
Okay. Well, that is a big point, because that's the concern about moving to electronic medical records that people have. That they're talking about phones that have all your medical information, all your credit card information on a smartphone, and so that can be a concern to people. So encrypting it seems only common sense. Well, we will interview you again as you move forward. I'm very interested to see how your pilots proceed and how this rollout happens. But you're certainly on the edge of this, and it couldn't be more timely, Dr. Akhtar. So thank you so much for joining us today. I appreciate it. We wish you the best of luck.
Thank you for having me.
Okay, Dr. Adil Akhtar, who is implementing mobile communications in healthcare technology. So 50% of mistakes could be reduced. If marriages communicated, we'd have 50% less divorces, as they say, but he is saving lives with this critical technology. Thanks for joining us at Next Wave's Leadership Forum today.